Hello, everybody. Welcome back to another episode of The Root of the Matter. I am your host, Dr. Rachaele Carver, and today this is a very exciting, really interesting new topic that I'm really excited to dig into. We are fortunate to have Dr. Jeff Gross with us today, who is the founder of ReCELLebrate and pioneer in regenerative stem cell and exosome medicine. So I'm sure everyone's kind of heard of the idea of stem cells, maybe exosomes, not so much. So we'll kind of talk about the difference there. And, what is this good for? Who can use it? How do we use it? How does it relate to oral health? So, Dr. Gross, thank you for joining us. Maybe just talk to us a little bit about your background, how you got into this, and why you founded the company.
Great. Yeah. Thank you for having me. It's great to be here. Please call me Jeff. So I'm a recovering neurosurgeon. I'm a spine surgeon by training. I had a fellowship in that. And for decades, I treated patients with neck and back problems, nerve problems, disc issues, things like that. And I had always been sort of butting my head up against the sick care system, the insurance driven cookbook, Kool-Aid drinking nonsense, and had always tried to find new and better ways for patients. As a surgeon, you learn to do surgery in your residency, and then the first thing you learn when you get out of your residency is how not to do it. So
No, I
always tried making that the last thing, right? So I had so many patients I treated over the years that they were in between the non-surgical treatments and the surgical treatments. So they tried therapies, they tried maybe some medications, some anti-inflammatories, they tried some injections, and they'd come to me and say, yeah, those things helped a little or temporarily, but I'm still having these issues. I say, well, gosh, the next thing on the menu is to talk about surgery. And they, oh, wait a minute, I'm not ready for that. I'm saying, great, because I really didn't want to have to offer it to you. But in the modern era with MRIs and things, we catch these things earlier. So we catch people in this limbo between non-surgical and surgical, and they're stuck there. So they ask, what about this? What about that? What about stem cells? So you hear that enough, you're frustrated enough, and chance favors the prepared mind. So luckily I have some undergraduate background in molecular biology, biochemistry. And I said, you know what? I know that these athletes have been going to Europe to get stem cells, Tiger Woods, Peyton Manning, these other guys, for years you hear about this. Something's going on. Something must be happening there. A lot must have happened since I went to college. So I decided one year, instead of going to these stuffy neurosurgery conferences, I don't know if you go to the dental ones, but it's the same academic bow tie wearing knuckleheads patting themselves on the back for doing the same old thing year after year, publishing the same thing that they published 50 years ago. Nothing's changing. It's stagnation. We don't do anything differently surgically than we were doing in the 1940s and 50s. Yeah, there's a new widget or gadget, but it's the same thing. So I said, screw that. I'm going to learn something new and better. So I started going to stem cell conferences and re-educated myself and took courses and read and read and read and did the homework and did the research. Luckily, the internet affords us access to a lot of the journal articles now, so you don't have to go sit in the library and pull a bound journal. It became clear to me that I wanted to offer this as a tool for my spine patients, but it has blossomed into so much more. And it's all I do now. And if I never do another spine surgery, I enjoy it. I'm good at it, but it's probably a service to most people. So that's kind of where we are.
Well, it's funny because I say that too. I'm looking forward to the day where I never pick up a drill ever again because I will have prevented all disease. And so that's why the whole idea of stem cells, right? It's very exciting. So
Yeah.
maybe for those of us who aren't really familiar, what is a stem cell? Why is it important? Why, as we get older, we have fewer and fewer? So why is it a good repair mechanism?
So let's talk about that. Stem cells created us. When you're a fertilized egg in your mother's womb, you are a single stem cell. You are the master stem cell from which all other cells will stem, hence its name. And from there, you develop into an embryo and a fetus, and you have these different types of stem cells. So stem cells just not one thing, but we have different types of stem cells. And eventually become almost ready to be born. You're this full-grown fetal baby, and you still have lots of stem cells, and they're floating around the amniotic fluid, and they're doing all kinds of magic to create you. Then you're born, and you're born, and you maintain many stem cells throughout your body, mostly in your bone marrow and your fat and other places. But those are the main stores. And during your growth, you're using those stem cells to grow and make new cells and develop and become an adult. And even as an adult, to renew and repair and restore and heal, you're tapping into stem cells to do that. Well, aging is this accumulation of cellular chronic inflammatory changes, and all our cells get affected by what's in our diet, what's in our water, what's not in our diet, what's, the electromagnetic forces around us, maybe mental stress, all kinds of bad stuff that we can't always control. So our cells get, they get rusty internally, they get oxidized, they don't function as well, and that's aging. It's called inflammaging if you want to be cute about it. And our stem cells are also affected by those same things. They become less functional. You mentioned earlier, they become fewer of them. That's true. You do exhaust the numbers, but you also exhaust the function. And that's why you can't heal and repair like a 3-year-old. You're made of the same genes you were when you were 3. And if you fell down and scraped your knee when you were 3, your mother would clean it up, put some Bactine on it, maybe a Band-Aid, kiss it, and send you on your way. 3 days later in the bathtub, that Band-Aid comes off and your scab's almost healed, done. And if you bang your arm on something, you got a bruise for like a week and a half, 2 weeks. Well, wait a minute, how come you can't heal as fast? Because your stem cell restorative functions just aren't there. So that's where we tap into the strategy of stem cell medicine, or what we call regenerative medicine, to help regenerate you, to leverage that youthful healing ability in someone who needs it. That's the magic.
Yeah. And that's, again, what's exciting for those of us who are hoping to, not just live longer, but live better. That's what we need to do, right? How do we maintain a robust immune system? How do we heal? I used to always wear a badge of honor, like I never get sick. And then I kind of learned, well, that's not necessarily the goal. The goal is if you, and when you get sick, you heal quickly, right?
Yeah.
And I remember my kids, when they were little, they had great diet, great exercise, all the things, and they'd get sick 24 hours. Now, as teenagers, and they're eating all the junk and they're staying up late and they got the cell phones, right? They can be down for a week, right?
Yep.
And so that's the thing. Like, how do we build resilience? And there are some things that are, it's challenging, and maybe we have to have a 9 to 5, 40-hour job, and we can't go in the sunshine. We can't do we can't meditate for 2 hours,
Right.
every day. So this is where, that the science and the spirituality can kind of combine, right? Where we can, we need sometimes help. I've even evolved too. It's like, hey, I was
Yep.
so resistant to antibiotics for a while after learning all this biological, but at the same time, it's like, well, sometimes we actually need them, So it should
Yeah, of
be
course.
uh, you know, either or, but an and. So, and I know when I started learning extractions and started learning about platelet-rich fibrin, we were told, oh, this is great, that's, you want the stem cells from the platelets, right? And it's gonna help everything grow faster. And I have to say, the healing of the soft tissue is, oh my God, like 10 to 100 times faster. It's just amazing how in a few weeks it looks like what it maybe would look like typically if I didn't use PRF, in 12 weeks.
Yep.
So it's really incredible. But
Yep.
then I started to learn, well, after 40, maybe our stem cells aren't so great. So is it really the stem cells? I mean, again, it's your own body, so it's good healing. But am I getting what I originally thought, right? Am I really putting stem cells in there, or are there better ways? So I'd love to have you tell us a little bit how to use stem cells, whether it's in an extraction site or, in a degenerative spine bone issue.
Well, this has evolved. So I'm going to speak at the 2025 best and latest knowledge. A lot of doctors are practicing stem cell medicine, are still practicing in the 1990s, where they are harvesting stem cells from the bone in your hip and things like that. And that's fine. There's nothing wrong with that. But it's certainly not the most active and most efficient way to do it these days. We've learned something in that to get the benefit of a regenerative biologic, a stem cell or something like that, that the benefits come from the cell signaling. So a stem cell messages our cells. And at the end of the day, our cells do the work. The bone in the jaw, if you want to deposit more bone, has to be reinvigorated. Or like you said, the gum and the soft things around that area have to be signaled to heal like a younger person, right? So the cells give off two kinds of signaling. Signaling number one is growth factors, little proteins that stimulate the laying down of new vessels and capillaries in the healing. And you find these robust in the amniotic fluid. You find them in platelet rich plasma or platelet rich fibrin, which you use in the dental industry. And these come from the own body. But you're right. If they come from a 70-year-old body in the blood, they're not as robust as when that 70-year-old was, 5. So we like to tap into the youthful sources. Then the other signaling from stem cells in the regenerative capacity is called extracellular vesicles, or for short, exosomes. And for those of you watching this broadcast and not just listening to it, at the bottom of my screen it says Dr. Jeff exosomes, and that's the short word for these vesicles. All cells make exosomes. All cells signal their neighbors. They're always talking. They're always communicating. Think about the movie Avatar, where all the trees and nature were communicating with each other through the rootlets and things. So cells are constantly telling their neighbors what's going on and trying to influence them. Well, what we want here in a regenerative approach is that regenerative, youthful, restorative signal. So we can tap into that through the exosomes and the growth factors. These are, again, robust when you in the bloodstream, in the bone marrow, in amniotic fluid, in umbilical cord jelly called Wharton's jelly. All these things have it. And you have some of these in platelet-rich plasma, platelet-rich fibrin. They can come in many ways.
Yeah, it's really fascinating. This is why I love ozone. It's another one of those signaling molecules. That's what I tell patients. When I first learned, I was like, "Oh, this is the greatest thing ever. It's going to cure everything." But you have to remember something with natural. It's not a steroid. It's not stopping something. It's actually signaling your cells to heal themselves, and that's why there's no side effects, no contraindications. Like, this is a natural process, and that's where we get real healing. What you say about the growth factor, right? The blood supply. This is another reason I don't use any epinephrine in any of my patients,
Right.
right? So I think that is a really big reason why my extractions, they heal so well. Not only the ozone and my laser and all the things, but by not shutting down the blood flow for 90 minutes or whatever it may be, we're making sure. And sometimes, yeah, it's a little messy. I got to have a lot of suction, but I'd so much rather it take me a little bit longer so that I never cut off that blood supply to, again,
Right.
ensure that all those cells and all the blood flow, and it's getting there immediately.
Yes, I agree with you. So obviously, for those that don't know, epinephrine is also known as adrenaline, and it causes your small vessels to constrict, so you don't have as much blood flow. So sometimes when you put in a numbing agent, right, the strategy is let's keep more of that there by not letting the
Mhm.
bloodstream take it away. The problem is you need those capillaries open to do their healing. So you have a little more bleeding during that procedure, but that you can control, of course. And it's almost, this self-fulfilling prophecy. You should not use the epinephrine, collect the blood, and you can get your PRF
Yeah.
from the blood. You don't have to do a
Blood draw.
venous blood draw from the arm, right?
Yes. Exactly. I know. I think about that. I was thinking about the other day because my phlebotomist is out for a month, and I was like, okay, I don't love doing this, but I have to do it. But man, those
Got to
hard
do
cases,
it.
I'm like, oh, geez, yeah, let me just take it from the extraction site,
Yeah,
possibly.
and of course, you're right. The more vascular your tissues, and in this case, your gums and local tissues, the better people heal, the fewer diseases they have, because the blood flow brings the immune system, clears things out, and does the job. It's people with poor blood supply have more disease type problems. They have trouble healing an infection. They have trouble healing local bone, which is relevant to the dental industry, of course. So I'm with you there. It applies beyond the mouth. Just
Yeah.
for everyone listening, this applies to the feet and the joints and the spine and everything.
So tell us about, like, you're got a past of doing spine surgery, so
Yeah,
around, with bones. So somebody, we work with a lot of people, they've got the cervical spine. Every time I take a 3D X-ray, it's like I think 9 out of 10 times the radiologist says, cervical changes, spine. We hold so much tension and pain and everything in our
yeah,
neck, and now with this
yeah.
forward neck posture and modern life. So tell us a little bit how you'd use cells in, like, disc degeneration, or however you use it for that.
So the spine has two dominant, not only, but two dominant sources of pain. One is problems with the disc, where the disc wears down, and problems with the joints in the back of the spine called the facet joints. So, first, we need to confirm the source of the pain or the problem. Sometimes it's one, sometimes it's the other, sometimes it's both. Facet joints tend to behave like other joints in the body, knees, shoulders, knuckles, what have you. Typically, we can inject around those joints with regenerative biologics. Now, we're using the phrase stem cells here, but we've skipped beyond the stem cells now. Stem cells are really just a delivery vehicle. Stem cells make the growth factors and the exosomes. We go right to those because they travel through tissue better and they're less expensive. So, and they are the business end of the stem cells, but we call it stem cell medicine so people can understand it. But we're not delivering cells any longer often. We still have some applications. So we can inject around those facet joints, in the facet joints. We're actually injecting these days the bone because the cartilage forming cells, and this may have some overlap in your field, the cartilage forming cells in the joint that, causing the wearing of the cartilage, the osteoarthritis of that area are in the bone. So people for years have been injecting the cartilage only to find out the cartilage has very few cells, nothing to affect. It's sort of the result. Just like hair is a protein made by a follicle in your scalp, cartilage is a protein made by a chondrocyte cell in your bone. So we inject the bone, obviously a little sedation for that because it's in the bone. If we're dealing with the disc, it's a little more challenging. And this is going to really be interesting for the dental side of things because disc is made of two different types of cartilage. And the problems with disc in part come from the bone above and below. So we can inject those just like we do those facet joints and other joints and get some improvement in the regular cartilage. But the deeper nuclear cartilage, the part that herniates out and gets worn down, is from a different part of the embryo called the endoderm, which we don't have a lot of body parts made of the endoderm. Whereas in the dental side of things, teeth are interesting from ectoderm, and the brain and nervous system in the teeth and a few glandular cells are from the ectoderm system. So most of the rest of the body, structurally and organ-wise, is from the middle layer of the embryo called the mesoderm, and most stem cells stimulate mesoderm. These stem cells are called MSCs, or mesenchymal stromal cells, and mesenchyme and mesoderm kind of go together. But as we become better at learning how to use regenerative medicine, we're finding in the dental side of things that we need these ectoderm stimulating exosomes and things like that. So that is the key in that arena. We're looking at using different types of stem cells called Muse cells, which are a subset of stem cells to stimulate these other embryonic origins like ectoderm and endoderm. So I think you're going to see that in the dental side of things, and we're just now using them to do a sandwich therapy for the disc. So Muse cells to stimulate, or Muse cell exosomes to stimulate the nucleus to, be more restorative and youthful, and then the regular mesodermal mesenchymal, amniotic exosomes and growth factors for the bone. So the disc is complex, is what I'm trying to say in all this.
But that's exciting because, exactly what you're talking about. You may be talking about the spine, but you're equally talking about the temporomandibular joint, right? We get people always,
Right.
I have TMD or TMJ,
Correct.
we say, right? Yes, you have two TMJs. TMD, the professionals call it temporomandibular dysfunction. And we can look at x-rays and, determine what's going on. Is it a bone thing, disc thing, sometimes both. But that, again, just like you said, first you got to figure out what's happening, right? Because a lot of it is musculature, right? So you got to calm down the muscles, or the way the teeth are hitting are causing the muscles to become dysfunctional and then pulling the joint out of alignment. So,
Right.
I use a lot of the prolozone therapy for TMD patients, which is unbelievable. It can last over a year, and we're not, unlike Botox, I'm not putting a toxin, right near your
Right.
brain. And so that's exciting. So I'm really excited to keep learning more about, and it's exciting to know that distinction, right, with the ectodermal tissue, that it has to be a little bit different, maybe.
Yep. And we're seeing that now because people are using teeth or dental stem cells, which are ectodermal, neural ectoderm, to regrow teeth and in the lab, and maybe regrow even some part of the nervous system, since they have common lineage, common parents or grandparents in the cellular sense. But tapping back into the TMD, TMJ conversation, what we're doing is we will get a high quality MRI, and with some special sequences called inversion recovery. You have to order those special from the secret menu. And we will look at the bone adjacent to the disc on either side. And we are seeing the inflammatory damage in the chondrocytes that are supposed to create and support the disc, which is like many joints. So we're designing a specialized needle to get in the bone, because most of our bone needles for knees and spine are a bit too big.
Mhm.
right? So we need a smaller, so we're designing that now, and soon we'll be able to, for the patients that don't respond to the prolozone
Mhm.
and more, we'll call it easier treatments. We think we are going to have something for their, stimulating the chondrocytes in the bone on either side of the disc. So let's keep in touch on that.
Yeah, that's really exciting. Now, let's say, is there any alternative for stem cells to be instead of being injected? Are there any other ways we can signal increased stem cells in our body?
Yeah. So you don't need to see me. It's free to stimulate your own stem cell activity. Here are some ways you can do it. You can fast, you can do hot sauna, real hot sauna, like, 180 degrees for 20 minutes or more, 5 days a week, like the Finns do. You can do cold plunge, you can do high intensity exercise. All these things get rid of your senescent cells, your age cells, and improve your own release of stem cells. You can do that because you want to get rid of a lot the older boggy cells, the zombie cells. So you can, fasting is probably the easiest way to do that. A good 3-day fast will reboot your immune system, your bone marrow will be stimulated. You can donate blood. That's a good one. Women tend to lose blood monthly during their cycles, so they have that survival advantage. Of course, you want women to have survival advantage during baby making years. They're going to have babies, of course. So that's built in biologically and naturally. And then you can, there are certain supplements that stimulate, things. You can also get exosomes in nature. You can get exosomes from bone broth because it comes from the bone marrow, the bone stock. You can eat bone marrow, and some of those exosomes will benefit you. Chicken soup. Why does grandma make you chicken soup when you're sick? Because it comes from the chicken stock, which is chicken bone marrow, which has stem cells and exosomes, and some of those survive and get into you and help you. Colostrum and milk, whole milk, have exosomes, mammalian exosomes, and plants, would you believe, make exosomes and have stem cells. And those plant exosomes are how plants deliver their phytonutrients. So all the little biochemicals from plants you hear about that are a big part of the supplement side of things, because we don't really get enough in our diet. Those are in exosomes, and there's now a product on the market that is plant exosomes, which will deliver those to you.
But if it's coming from a plant, how does that help us as humans? The same as signaling?
No, no, we don't get the same signaling. It's a delivery of phytonutrients, and because it's nature puts it in an exosome, it
I
delivers
see.
to your cell.
Got it.
Whereas
The packaging.
if you went to the vitamin shop and got a bottle of resveratrol,
Mhm.
which is an example of a phytonutrient that is known to stimulate sirtuin-1 gene, anti-aging gene activity. That is already extracted out of the exosome. You lose some during the digestion process, and once it gets into your bloodstream, that doesn't mean it's getting into your cells to do the work. Whereas nature's already figured that out. The
Mhm.
difficulty was finding a lab to extract the exosomes from the plants, but we have that now.
Yeah, that's exciting, and that's a big controversy, right, in the supplements. Well, some doctors don't believe in any of the supplements. They say, it's just expensive urine, which in many cases it can be, right? Because we've got
It can be,
all
yeah.
this synthetic stuff. We've got, and then like you said, the ability, how much actually, this is a big controversy with probiotics, like how much actually make it past the stomach acid for it to even be worthwhile, right? So
Yeah,
there's, all these different mechanisms we've talked about.
yeah.
Now there's liposomal delivery of stuff to try to absorb through the fatty layer of cells. And my one of my favorite companies, Cellcore, they have this carbon technology, that allows things to. So that's interesting that you say. So it's in the packaging, and like that's what we tell a lot of patients. Yes, ideally we should get all our nutrients from food because it's in the right ratios. It's recognized by our body. Unfortunately, so much food today is lacking, in
Yes,
things.
you're completely correct. I agree 100%. But you mentioned liposome, which is an improved way to deliver nutrients through your GI tract and into your cells. Well, nature's already figured that out. An exosome is, nature's liposome. A liposome is a synthetic exosome. They're trying to recreate nature. It's easier just to get it from nature. Now, it's hard to eat enough diverse fruits and vegetables in a day to get this. That's why now it's figured out.
So if somebody's kind of interested in this, one, are there any contraindications to exosome therapy?
Yeah, so we don't give standard regenerative exosome therapy to anyone with cancer, not because it'll stimulate the cancer, it's because we just don't know if it's safe. enough or not. And that causes me to remind everyone listening that the FDA has not yet approved for marketing claims, which is what the FDA does. They approve marketing claims. They haven't unapproved or disapproved. They just haven't approved yet. So it's sort of in limbo. PRF, PRP, stem cells, and exosomes. All those things fall into the same category. Are we using them? Absolutely. Does your dentist maybe use PRF? Yes. Does your orthopedic use PRP? Yes. Can you get an amnio patch on your cornea if you have dry eyes? Yes. All these things are available, but we have to give proper informed consent, and we're not allowed to make any claims that they cure or treat. So having said that, because we want to maintain compliance, it's still one of the jobs of a clinician like a dentist or a doctor to protect patients by making the latest and some of the best things available to them, right? So that's part of our oath. You guys have an oath? You do a Hippocratic oath
Yes,
or
we do.
something? Okay. So we're under the same oath, and that transcends everything. Our duty to the patient is utmost always. So those are the types of things that we have to consider when doing the informed consent. And I lost track of the exact question that you
No,
started
I was
with.
just asking about contraindications. So you said cancer
Oh,
patients
cancer.
don't know
Yeah,
enough.
we have that. Obviously, anyone with who's on a blood thinner, we can't really. It's hard to inject a person. So we might have to take a day off the blood thinner, a couple of days off, depends. If it's really mild, uh, that someone who's on steroids, the regeneratives just don't work well in the face of immunosuppressants like steroids. So we try to flip people off steroids. An interesting side note, if you allow, I treated a woman for knee issues and we did some injections and she just wasn't making progress a few months later, which, I get concerned because mostly they do. And the literature suggests that. By the way, in Europe, they have like 15-year follow-up. We're just behind the times here in the States. So this
Sure.
woman wasn't making progress. So I had a longer visit with her and she tells me we went over her medicines, which we had done before, and I had asked her to curtail this, but she hadn't. Her regular doctor put her on a steroid inhaler like 2 years ago because she had bronchitis and never stopped. So she's on this immunosuppressant inhaler just because it was like she was just doing what her doctor told her. So we stopped it, and then within a few months, her knee turned the corner. Now I don't know if stopping it was the difference maker. Maybe it just finally got better, but I'm worried, and
At
we
least a
really try to
lot.
make sure.
I'm sure.
Yeah, yeah.
So tell me, because I probably should have started with the question, like, what are the procedures or ailments or conditions that stem cells have the longest positive impact? So you talk about knee. So is it arthritis cases? Mm,
Yep. Well, I mean, we misuse that word, arthritis. It really means generally osteoarthritis, which is a wearing and tearing of the bone and cartilage. But you go to see the orthopedic surgeon, they do an X-ray, and they say your cartilage is wearing down. You're almost bone on bone. You need a joint replacement. Well, it turns out that's really a disease of the bone edge, those chondrocytes in the bone edge. So we treat the root cause. We don't treat the cartilage. That's like putting stem cells on your hair, hoping to grow more hair. That won't work. You got to put them in the scalp where the cells are.
right.
So that's the longest and some of the best results come in this musculoskeletal joint degenerative osteoarthritis, bone on bone, cartilage wear and tear type situation. And that's all those words fit together. Whether your doctor just calls it arthritis to be quick and simple with you, or you've heard the word chondromalacia, which is really the wearing down of the cartilage. It's the result, not the cause.
Mhm.
Yes, tearing your cartilage does cause some accelerated degeneration. Yes, having a knee scope or a joint scope to trim some cartilage helps you in the moment, but does accelerate the degenerative process. That's where we come in. That's probably across the board the low hanging fruit.
Yeah. So, I mean, I think practically every week, I'm signing off on the oral health person before they go in for a total joint replacement. Would you say, or can you give us some examples of patients have you been able to, in your experience, prevent total joint replacements?
Yeah. So I'm going to quote the literature first. The French literature on this topic, and when they looked at knees, and they have over 15-year follow-up, shows at 15 years they were able to save 82% of people who needed a knee replacement by doing injection in the bone. If they just injected in the cartilage, they only saved just under 25%.
Mhm. Wow. That's a big
So that's why we do the bone.
difference.
Plus, we're targeting a little more efficiently with these MRI with the inversion recovery sequence. It really shows you the bony changes, and we're getting similar results. Now, I've only been doing this 7 years, so I don't have 15-year follow up, but our data tracks. We have about 700 joints and only 2 people have gone on to do surgery
Wow.
of the 700 so far. And we're tracking, maybe a few more will. And
Yeah.
of course, if someone's not doing well, I want to relook at them. Maybe I didn't put enough. Maybe we need to do some more, let's not
Well,
give up.
I'd say that's really impressive because, I mean, there's so many lifestyle factors, right, that go into, the breakdown. So the fact that you can use, this one product and have such drastic results is amazing because most people know, yes, I should lose weight, I should eat better, I should stop all this stuff. But, let's be real. A lot of us are like, please just give me the quick fix. So, man,
Well, you're right.
and if you
You're
ever
right.
watch any of those doctor shows, I swear every show has had at least one episode where the person is getting poisoned by their
Yeah.
titanium hip or whatever the old stuff
Yeah.
is.
Yeah.
So it's a real thing. If we can prevent putting, heavy metals in the person's body, like this is amazing. And it's obviously a lot less recovery. Like what talk to me about the procedure. How long
Yeah.
does it last?
Yeah, let's do that. But first, you made me realize that we do work on the whole person. We get better results if the patients are improving their lifestyle, their diet, their supplements, their sleep, their mental state, their supplements, you know, exercise, everything has to be looked at. It helps you heal. And we look at hormone optimization, we look at peptide use, all kinds of things. So, but typically it's a one and done, a single injection. We do it under a little sedation. The results take 6 to 12 months to be fully manifest, although some people have improvement in pain initially because there's an anti-inflammatory benefit, like a steroid injection, but without the downside,
Mm.
because repeat steroid injections, of course, can cause long-term problems. So that's typically what we see. Knees are probably the low-hanging fruit. We do all kinds of joints. I do ankles and wrists and thumbs and toes and things like that. Anybody looking to avoid a surgery, we're probably the group you want to talk to. I'm probably the guy you want to have a video consultation with. And most of our patients are from somewhere else. We're based in Las Vegas, Nevada, but through the magic of what we're doing here, we're doing a video. In the post-COVID world, so many of our visits are by video. We can order MRIs remotely. We can look at them. I can share my screen and show them to people. So we only invite people here if they're a good candidate for a treatment. And that's kind of how it works. And we follow them out for at least a year.
So that's so relative. And what's the downtime? Let's say you inject the knee. Are they
None,
what?
none, no downtime. You'll be sore from the injection because it's in your bone, like you might be from a dental procedure, you'd be sore.
Mhm.
But, most people, we want up and using the joint, stimulating the joint, getting the mechanoreceptors going and which cause those cells to release, cytokines, little proteins that call for the healing. We want people right back at their activities. You don't necessarily have to do physical therapy as long as you use the joint properly and well. And I mean, we've had people, I did a guy's shoulder and he played golf the next day. Now, I don't know that I would have recommended that, but he had a great tee time. He didn't want to miss it. And he told me later, he's like, I was sore. I probably shouldn't have that day, but I had to.
Oh, that's great.
Yeah.
So joints, that's kind of the number one thing that they've been used for. What are the other indications?
So we use the same regenerative biologics, these amniotic fluid products for inflammatory issues. So people with autoimmune issues, maybe long infections that have a big inflammatory component, like a long COVID or a Lyme's or post-Lyme syndrome, any disease that has an inflammatory component, we seek to help the cells fight the inflammatory issues. So a lot of the diseases of aging are diseases of inflammation. Well, that makes sense since inflammation and aging go hand in hand.
Mhm.
So, we've looked at people with MS and Alzheimer's and of course diffuse osteoarthritis. If you have it in every joint, we're not going to inject every joint, right? So
Yeah.
sometimes we start with an IV. We have addressed organ failure. We've had people that were borderline needing dialysis and helped their kidney function, prevented dialysis. It helps. We've seen the improvement in insulin sensitivity. So if you're looking at maybe a diabetes where you're facing potential use of insulin, we might be able to help there. Again, I'm not allowed to make claims, but it's worth trying.
Yeah, sure.
And some people like myself, we do the IVs just to get a little boost, suppress inflammatory damage, kind of a longevity thing we like to do,
Mhm.
biohacking. So I do it 4 times a year. My wife does it. My mother comes in, flies in and father do it twice a year. So It can help give you energy, improve your mental speed and sharpness, help you fight infection. We also do breathing treatments with the biologics, where we've had someone who was oxygen dependent. We gave them a breathing treatment, and now they're no longer requiring the oxygen tank. I mean, we all require oxygen, but
Right,
she doesn't have to roll around the little tank,
right.
right?
Yeah.
So, what else? We have a nasal spray application for brain health because the exosomes are small enough to cross the blood-brain barrier, whereas stem cells do not cross. So, and let's think about this. You've had children, other people who are pregnant. Pregnant women will tell you their skin is glowing, their hair is
Mhm.
growing. And why is that? They're getting a daily dose of exosomes through the placental membrane. They're not getting stem cells. You can't have stem cells cross the placenta.
So
Plus,
that's
those stems,
they often say that women's, their autoimmune condition will go away during pregnancy.
yes.
This is
Yeah,
why.
they're getting a test dose of exosomes from their own baby, and they can't get stem cells from the baby because the baby is genetically half foreign to them, and they don't want to reject the baby.
Mhm.
So the exosomes are so naive and neutral. There's no cell, there's no really appreciable DNA or anything. Exosomes contain peptides and growth factors and microRNAs, baby making magic. So that's why we love these. And parenthetically, we get these from labs that are ironically FDA certified and compliant. And the labs get them from American Tissue Bank Donor Services. So you've probably used some bone graft material in the past for some procedures that you get from the donor bank.
Mhm.
And the particular lab we use gets the amniotic fluid from non-COVID vaccinated mothers. Why? Because we don't know what that variable means fully. Let's be honest. These are from healthy mothers. They don't drink, smoke, or use drugs. They're allowed one romantic partner during the pregnancy only, so they're not out goofing around too much. And they have to be healthy. They have to be taking prenatal vitamins, and they're screened again at the time of their C-section. Has to be a C-section because it's sterile. Like you mentioned earlier, the mouth is not sterile.
Mhm.
But luckily, it's got good blood flow generally. The same thing, a vaginal delivery is not a sterile delivery. So we has to be a C-section, and they have exactly 60 seconds to suction the amniotic fluid before they deliver the baby. So this is very highly controlled. It goes right to ice, right to the lab where it's tested and screened again, and we get them fresh frozen. So nothing's powdered or cooked. It's all fresh frozen amniotic fluid. That's really what we're using. Rich in exosomes from stem cells, rich in growth factors, proteins, peptides.
I heard you mention earlier there's something that you can put on the eye for dry eye. Something I'm suffering from is driving me bananas. I'm like, tell me what
Yeah.
that is.
Well, it's something that the eye doctors use. It's an amnio patch. It's from the amniotic membrane.
Mhm.
So there are a couple different things you can do. Dry eyes is complex, right? We see this in women with changing hormones. So you gotta maintain the hormone bioidentical hormone management, and hydration, and you want to re-stimulate these meibomian glands. Some of times they're just gunked up. They're little duct-like glands, and they need to be expressed or squeezed out. And sometimes you do that a few times. They can do what's called IPL, which is a laser, and kind of warm and melt the goo that we create. We just block those ducts, and you just need to
Mhm.
express them a few times. Sometimes that's all you need. We have injected exosomes into the eyelid, not the eye, the eyelid, because that's where those glands live, and we've seen some improvement. We haven't had it last more than 6 months though, and it's kind of an annoying thing to do every 6 months.
Yeah.
So, but the eye doctors have an amnio patch they put on the cornea, and it's supposed to help. Doesn't it? It's an option. It's an easy thing to do. They just lay it on there.
Interesting. Yeah, definitely in that hormonal swing right now. So trying to dial those all in.
Fight, fight, fight. You got to make sure you manage that because you will age a lot slower if you do. You will maintain your bone density, you will maintain
Exactly.
your muscle mass, you will slow the risk of dementia and cardiovascular disease if you can maintain your youthful profile. And we know this, women who have late menses, late pregnancies live longer.
Interesting. Yeah. Yeah. Makes sense. You got all those good hormones, flooding me. I tell a lot of my women, it's hard to find the doctors really who
Yep.
understand how to do it properly, right? That's can sometimes
Yes,
be
it,
the
it has to be bioidentical. You can't take these synthetic or horse urine based things that they're the problem. And a lot of the myths related to using these hormones have been debunked. So if you're out there and your doctor is scared to use them, you need to find someone to do it for you, ladies.
absolutely. And there are people out there, right? So
They're out there.
contact me. I'll put you in touch with the right people.
And not just ladies. Let's be fair, guys. We're seeing lower testosterone earlier and earlier in 30s and 40-year-olds, and you will lose your muscle mass and you will wither away and you will not have a longevity. You have to have a longevity plan. You have to script it out and follow it early. That's preventative medicine 3.0. You have to do that.
And it's just crazy to think how many, the fertility clinics are overflowing these days. I mean, it's nuts. I have two sisters; they've both had fertility, treatments, and young, healthy people. It's
Yep.
just crazy the
Yep.
world we live in today. So,
It is. It is.
yeah,
But there
definitely.
are answers, and a lot of those answers are natural, holistic. And I haven't found any issues with them, but I'm not allowed to make the claim they're safe because the FDA tells me that I can't make that until they tell me I can make that. So in Europe, they're approved. They're safe in Europe, but when you fly from Europe to the US, we can't say that.
Yes, like a lot of great, biologic things that we're doing too. So I think it's really exciting. And what I'm, thinking about the patient I had yesterday who said, "Well, okay, but if you get rid of all these heavy metals and you get rid of all the infections in my mouth, can you regrow my bone?" And I'm like, I haven't seen it yet. I'm not to say that
You
you don't
can.
do it, but with
You can.
exosomes, that seems like a promising way to go about it.
Yeah, and exosomes may only be part of it, right? You need some good bone matrix. I don't know if you use bone morphogenic protein to
Hmm.
help grow bone. I mean, that can be quite a useful thing. Yeah, it costs a couple $1,000s a dose, but if you want to grow bone quickly and be able to do whatever restoration you're doing, that's a shorter path for
Hmm.
sure. I've seen it.
Yeah. So exciting. Yes. And the more common it becomes, the price will come down hopefully so we can, but that's what I'm excited to see, is regenerate. Like I said, I don't ever want to have to pick up my drill ever again. I want to do all this regenerative and preventative, type of work, really having people understand what is the root of decay, how, and even talking about that, to me, the more that I see it, there's so much where the immune system, is getting bogged down. We talk about, oh, you didn't brush, you didn't floss, you get admonished by your hygienist for not doing good oral care. And that's not it. That's such a small
Yep.
fragment of what's going on at the deeper level.
Yeah.
So
Oh, yeah.
it's
And
such a,
we're learning more all the time. We're learning about these individual peptides and things that have benefits and different types of exosomes. I mean, this is just the beginning. You're
yeah,
right.
it's really exciting. So we're about coming up on our time. Is there anything else exciting around the whole science of exosomes, or something that you think is going to be the next great thing?
Yeah, we're looking at, like I told you, the tissue specific lineage exosomes, being more specific about different things we apply them for. We're looking at a better use of the muse cells and their exosomes. We're looking at different peptides and proteins and growth factors strategically. Some are anti aging, like the clotho and the FOXO4, things like this. So these are things that will be available. Some of them are not necessarily here, but we're trying to foster pathways to protect our patients' access to want to try these things. We're looking at, we have some things we're working on the cancer side of things using natural killer cell exosomes, which we didn't really delve into, but we do have that. And we're looking at designer exosomes. They have these in China. We don't have them here yet. But for example, exosomes that will deliver more mitochondria to donate to your cells so they can be more efficient metabolically and make more muscle, all kinds of fun things coming.
Yeah, but it's very exciting, and it's definitely kind of on that cutting edge, but it is available now. So if somebody is interested, wants to learn more about you, your company, where you're located, how do they reach out to you?
Well, our company is called ReCELLebrate, ReCELLebrate, because we're celebrating the renewal of your cells. So that's our fun name. And if you put that in your web browser and search it, we will probably come up because we made up the word. And I think we cornered the internet on the word. So ReCELLebrate.com. Our Instagram is at ReCELLebrate. You can find us on all the major social networks and Facebook and what have you. So just check us out, reach out. We love to meet new people. Be happy to have a conversation, talk about any. We love to look into new issues too. We do the homework, we look at the research, we see what's out there. We're not just shooting from the hip.
Yeah. Yeah, it's exciting. And, people who are listening to this podcast are, want the more natural alternative. They want to try to avoid those, the hip replacements, the tooth
Yeah.
replacements, all those kind of things. So
Yeah.
I really appreciate your time today. Everybody, you've got that. We'll also copy down the site for you in the show notes. So if you didn't catch it, if you're just listening, it'll be there for you. So Thank you so much, Dr.
Thank
Jeff.
you.
We appreciate your time. I hope everybody enjoyed learning something new, perhaps. And please reach out to Dr. Gross if you want to learn more about stem cells and exosomes. And otherwise, we'll just catch you on the next episode, everyone. Have a great day.